off and lie down on the table with your head up here. Just like the Thomas test, this has a lot of parts because there's a lot of different things. What I'm going to look for is protraction of the shoulders, or forward motion of the shoulders. Looking for the pectoralis minor. So the first thing I'm going to do is explain the test. You got your good checklist out. I want people to check me when I miss something. Let me know. Because sometimes we're going to miss things to see if you're watching. I'm going to bend his knees. Start position. Put his hands at his side, palms up. Okay? I'll probably put a pillow on his head because it's uncomfortable. Okay, so just relax. If anything bothers you, let me know. First thing I'm going to do, and people can get behind me, I'm going to stand at the head of the table, and I'm going to observe his acromion processes. Are they level? Pretty close. The right side may be a bit elevated, and when we get into shoulder, I'll bring a little measuring device that I invented to measure this. You could measure from the going out and eyeball it, but you got to watch pushing into the table. And do his scapula look forwardly rotated and protracted. Okay, so they both look a little bit elevated, with the right maybe more than the left. So if we say his right's involved, I'm going to test the left first. So, okay, I've already looked. It looks a bit elevated. That could be pec minor. So what I'm going to do is palpate the coracoid process using my thenar eminence. I'm going to kind of take up the slack in the skin because if I just stabilize it and I stretch his skin, that's going to be a bit uncomfortable. I'm going to slide the skin forward a little bit, go in the coracoid process, and just stabilize it, okay? First thing I'm going to do, what muscle attaches to the coracoid process? Coracobrachialis and the biceps. So, could it be the biceps that's pulling it forward? By stabilizing it, relax. I'm going to passively flex the elbow. So I've shortened the biceps, but I'm looking for the short head because I'm on the coracoid process. And I've got to pay attention what's happening under here. I'm trying to feel that coracoid process. Does it kind of go down away from my thenar eminence? No. I don't have to go all the way up here, because I just shorten it a little bit, and if it doesn't go away, the short head of the biceps is not causing that tightness. Okay, next step would be coracobrachialis, which also attaches there but flexes the shoulder. So relax, and I'm going to flex his shoulder. And I'm shortening the coracobrachialis, right? And I feel the coracoid process depress slightly away from my thenar eminence. So I'm saying his coracobrachialis is a bit short, as well as the pec minor. It's probably both. Any problem with that? You breathing? You're awake. I'm trying. So I look. Right looks a little higher, but I'm testing uninvolved. Take up the slack and stabilize the coracoid process, which is the scapula. Relax. Passively flex the elbow. So I'm shortening the short head of the biceps. Nothing happens. Short head of the biceps, not a problem. Passively flex the shoulder. Coracoid process, I can feel slide down away from my thenar eminence. I use my thenar eminence because my hypothenar eminence is on his glenohumeral joint. I'm going to feel that motion. So you've got to differentiate what's happening here and what's happening here. Again, listening with your hands. You got to separate that motion. What's happening with the coracoid? Okay, it does go down a little bit. And it just takes a lot of practice to get that differentiation feeling. Now I'm going to do the other side. Doing all right? Good. Okay, your palms up. Okay. Got some shortness in the pec minor and the coracobrachialis. When we get into straight stretching, can we stretch both? Yeah, but we'll get into that. So, another one with a lot of steps, maybe not as many as the Thomas, but the steps are observation, measuring, that's the one thing we can measure, and then differentiation between the three muscles that can cause that protraction, that forward. I can kind of figure it out, because what I would do, you feel the stretch? Where do you feel it? Point. Okay. That'll kind of separate itself, but in most cases, you're gonna see, like in the rectus, saw a lot of rectus and combined TFL. Did anybody have rectus and sartorius? Haven't done the complete test, the length test of the pec minor. Substitutions, I gotta make sure he doesn't internally rotate, I'm gonna keep it externally rotated. And make sure his back's flat, not as big a portion, but here's the test position, knees bent, palms up. Okay? Anything to add?
Another one to practice, as you see, it builds. So let's get out and